Have you heard of leaky gut? It is a really common topic in the functional medicine, integrative health world. People kind of throw it around, like, oh, you might have leaky gut, or this is probably due to your leaky gut. And it could be a little bit difficult to understand what that actually means. So I wanted to clear that up for you today. So figuring out what leaky gut is going to be easiest when I have my nice little visual here for you guys. So I wanted to just kind of point out to you on here the different steps of leaky gut. First thing is this is a gut lining. It's 1 cell thick. It's this tiny little microscopic lining that separates what's inside your intestines to the inside of your body. And so that 1 cell lining is your barrier protecting you from the outside world. It's what this part is right here. And those cells are supposed to be nice and tight. And so if something wants entrance into your body, has to come and knock on the cell door and say, hey, am I allowed in? And your cell says, you're an undigested food particle, get digested butter, and I'll let you in later down the road. Or a toxin comes knocking in from a bacteria. It says, can I let in? And your cell's like, no, you're toxic and inflammatory. I'll send the immune system after you and we'll get rid of you. And so that's our nice little protective barrier. But what can happen is on this end right here, where you see that those cells have shrunken and become damaged. And so now, instead of getting permission, things like food and bacterial toxins and medications, they can just leak their way through to your bloodstream without getting permission, without being something that should be in your body. So the things that shouldn't be in your body that normally wouldn't get permission would be things that can make you more inflamed, make you more reactive, have the symptoms, things that we don't want there. And when they make their way in, they lead to all kinds of health issues because now we're more inflamed and more toxic and reactive. So we can have all kinds of issues like food reactions, immune system dysfunction, nutrient malabsorption. The gut's not able to absorb what it does need and it's absorbing things it shouldn't instead. So that can lead to a whole host of conditions like Hashimoto's, multiple sclerosis, rheumatoid arthritis, allergies, asthma, eczema, vitamin D deficiency, B12 deficiency. Your gut lining is like a filter. We need that filter to filter out all the stuff that shouldn't go into our body. But leaky gut is where there's too many holes in your filter and it's there all the time. Your body's not able to repair it fast enough. Leaky gut is normal for us to have some leakiness. We need it if we're sick or we're really stressed. But when it stays around and is there often, then that's more of leaky gut syndrome. And that's where you can end up with all of these things down here. So how do you know if you have leaky gut? Some of the common symptoms that you can experience that would give you a hint or clue you in that you might be dealing with leaky gut. The most obvious is going to be gut issues, right? So if your gut has nausea, indigestion, bloating, constipation, diarrhea, gassiness, those could be signs that there's too much inflammation in your gut. That's damaging your lining and things could then be leaking through. So I always like to use my handy dandy stool charts. I should have warned you first that I was gonna show you pictures of poop, but this is something that I use with every single patient that I evaluate in my practice, and so do my other nutritionists. And so if your stool is more of a type 1 or 2, that's kind of on the constipation spectrum. If it's more of this 6 or 7, that's more on the diarrhea spectrum. So it should be between a 3, 4, or 5. 4 is optimal. So if you might have these, upper or lower ones, that could be a sign your gut is inflamed, things aren't working right, you could be more leaky. Now, the gut impacts everything in the body. You can have a lot of other symptoms that are not just gut related. The biggest ones are going to be your brain, because there's a nice highway connecting those two. So you could actually experience anxiety or depression or brain fog or trouble sleeping, poor concentration, trouble remembering things. Those are all signs that you've got inflammation from your gut coming up to your brain. Now your skin barrier also is just like your gut barrier. So if your gut is too leaky, your skin can actually become leaky, and then you have more skin issues, hives, eczema, psoriasis, rashes. You can also know that you might have leaky gut if you have autoimmune disease. In order for your immune system to attack yourself, usually you have to have a leaky gut for a long period of time first to be able to develop those autoimmune conditions. I was the perfect storm of all of these different symptoms. So when I traveled to Central America, I got, E. coli in Mexico, and then salmonella in El Salvador. And when I came back to the US and was hospitalized, they said I had an amoeba parasite. I've had H. pylori in China, so I tend to pick up things when I travel. And I had just severe gut symptoms. For several months. I got treated for parasites. I went to the hospital, and even after that, I continued to have diarrhea constantly for 2 years. I had gut pain. I was so uncomfortable. And during this time, I had terrible acne throughout my face, skin rashes, and I developed severe Hashimoto's and hypothyroidism. So I was just all over the place. My brain fog was terrible, and I was able to eventually figure out how to treat my own gut because the doctors just couldn't help me. And so I got on a really good probiotic. I got on a different diet. I took some supplements that calm the gut down, and I've been able to resolve my IBS since then, as well as reduce my autoimmune markers and change a bunch of different things. So you can see when leaky gut flares, what the causes could be for that, which we'll talk about in just a moment, and then how different your life can be when you truly address the leaky gut. The other way to know if you have a leaky gut could be testing. I really don't do this very much in my practice. I like to save the time and expense, and we can usually figure it out pretty well from their history and their symptoms. But if you are going to test, there are a few ways. So you can do zonulin testing in the blood or the stool. Zonulin is like this strong bridge that keeps your cells together so that they can't become leaky. You can also do some testing with food testing. So if someone does have a lot of food sensitivities on their test, then you know that their gut is more leaky and allowing all those foods through. If they only have a few things, then they might not have very much of a leaky gut. The caveat being, not all tests are created equal. There are some tests that are a lot more accurate than others, so you can't just run any food sensitivity test and get a sense of leakiness from that. And then of course, the stool test is a way that you can do that and see how much inflammation is going on in the gut to let us know how leaky it could be. And then autoimmunity. So again, the higher the amount of autoimmune antibodies you have and the more severe your autoimmune disease is, more active, then the more leaky your gut tends to be. And I see this all the time with patients where they might come in and they are requesting a food test, and we prefer to run a food test, if at all, later on in their journey when we've corrected a lot of different things. But if they really want it right at the beginning, before I've had a chance to help them with their leaky gut, they'll come back with 40, 50 foods out of 100. And it's like, what can we do with this? Because their gut is just so leaky. But when we've had them on our program for just usually even 2 months, and then we do testing, we'll see maybe a max of 20 foods. It makes such a huge difference in a short period of time when you know how to address it. And that test can really, the food sensitivity test can really validate that for us. And so some of the root causes of leaky gut are really going to vary, of course, based off of your own history. So while I give you this list, it doesn't mean that everything on the list applies to you. But I have this nice little tool here from the Institute of Functional Medicine that tells us what some of the causes are for leaky gut on the left-hand side, and then what do we do to repair it on the other side. So some of the causes it lists for leaky gut here is genetics. So we might be just more prone than other people. People who have genes for celiac disease are way more prone to have a very leaky gut for a long period of time when they eat gluten. Nutritional history. If you're always eating things that are inflaming your guts, of course your gut is going to be more prone to being leaky. And then toxic burden. So not just toxins like pesticides and plastics, but mental emotional toxins like stress. Medications can have a very toxic impact on the gut. Infections, food allergies, and then of course the environmental toxins. So if we are being exposed to things that are damaging and creating holes in that filter that we talked about earlier, then we're going to end up with more of a leaky gut. And then if we add to that, improper diet, and we add to that medication or two, and we have some genes, now you can see we get this perfect little stew for keeping a leaky gut around and developing more health issues from it. So if we have, those as the root causes, then we have, for addressing the leaky gut, what we do about it is going to be treating those root causes. So how do you address it? You address it with having a healthier diet, with addressing your stress, with seeing what you can do with your medications if they're able to be reduced or to be weaned off of, with trying to decrease the toxic exposure in your life. Not just environmental toxins, but maybe toxic workplace or toxic relationships. And then infections. So we're looking at not just like you have an obvious infection like strep throat, but infections can also mean overgrowth, like imbalances in the bacteria or yeast or viral load of your body can really throw things off. A lot of us have these kinds of conditions and we're like, what do I need to do for my lungs or for my skin? And they don't realize what I actually need to do is start with the gut and make the gut less leaky. And there's a lot of different ways to do that because we all have a number of different root causes. So we always start with the foundations of wellness, helping your stress, helping your sleep, helping your diet, and then we add in healing nutrients. So there are specific nutrients that can help leaky gut that we can take supplementally to repair those holes and get the filter back to functioning well. And then there's optimizing digestion. That's a very often forgot about component of healing a leaky gut. You can optimize digestion with supplements. You can do a lot to optimize digestion with lifestyle. And we talk about all of these things in our follow-up appointments with the clients at our clinic. So if you want to get some more help on that, you want something customized to you, you can go to the link in the description for the video to schedule an appointment with someone to be able to work on your health. But otherwise, take a look at your own history, your own diet, stressors, and lifestyle medications, and see if there's some things that you can shift to protect your gut, because it is the foundation of your health. When you have a healthy gut, the rest of your life is going to be healthier. I cannot impress that point enough. I would love your support of me providing this information to you if you were to like and subscribe to the video, hit the little notifications bell so you know when I have new videos coming out, and then leave some comments below. Do you feel like you've experienced leaky gut? Is there something that you've done that have helped you to overcome it?